What if? Perhaps the most powerful two words in human history. What if we could make fire? What if we could fly? What if we could use a person's own cells to grow a new healthy organ to replace their diseased one? The man who asked that question also answered it by leading the first team to successfully grow and implant a human organ. In doing so, he changed the future of medicine.
We're not really looking just at technologies that can manage disease. We're looking at technologies that have the potential to treat and cure disease.
Dr. Atala's approach was simple. Take a small sample of the patient's own cells, grow them in the lab, construct a scaffold of biomaterial, then apply the cells to the scaffold, place it in an environment that simulates the body, and let the cells do what they know to do. In a short time, a new functioning organ is ready to implant. Simple concept, but attaining success took years.
Actually started out in this field creating these tissues and organs, making them one at a time, and actually creating them by hand. So the challenge for us is how do we actually scale up? And bioprinting ended up being an option that we could pursue. And bioprinting actually uses your typical printing technology, kind of like a desktop inkjet printer really, but instead of printing with ink, we're printing with cells.
Expanding on this idea, Dr. Atala and his team began using 3D printers to create more complex organs. This heart-like structure was created with a 3D printer, and a few minutes later, the cells began beating in synchronicity. Now, higher resolution 3D printers are being used to create solid organs like kidneys, but their work does not stop there.
We're currently working in about 30 different types of tissues and organs, and of course some of these we've already been able to put into patients. So our hope for the future really is to try to get even more numbers of organs that we can target, and also a lot more patients that can benefit from these technologies.
One of the newest techniques is to scan an injury, then place a printer over the patient and directly print the appropriate cells into the wound layer by layer.
And there's no doubt in my mind that the best possible solution for a patient who requires a tissue or an organ is to really replace it with one of their own. And so having these technologies that allow us to do that, and hopefully will allow us someday to be successful at this in large numbers, is really something that inspires not just me, but our whole team. In the future, the goal is, why can we not regenerate the organ itself inside the body without actually having to go through the outside process? And so we're looking at these alternative treatments and hopefully make our own technologies obsolete.
Dr. Anthony Atala focused forward.